Hello, good morning. I am Dr. Rajesh Gadia, consultant physician and intensivist. From today, we start a new method of presentation of cases, which earlier we used to do in a written format, and we'll start with a video presentation. This we'll be doing under the banner of clinical cases on HiDoc. So the first case for today is a 14-year-old girl. She comes from rural India. She's a student. And the most important, she aspires to be a doctor. She came to us a few days ago in the clinic and complains that she had fever 8 days ago for only 2 days. And thereafter she started getting severe leg pains. She had leg pains and weakness to such an extent that she could not walk on her own and she had to be lifted by 2 people, and that's how they got her to my clinic. She was put in the chair. You will be able to see that in the video which is accompanying this talk. In that, when we try to see her, even when we try to touch her legs, the lower limbs, she was complaining of severe pain. So we could not assess whether it was weakness or pain which was making her unable to walk. She had no complaints in the upper limbs, she had no speech disturbance, she had no vomiting, no loose motion, nothing else. So for evaluation, for further evaluation, we admitted her to the hospital. When we examined her, we found that the lower limb power was around grade 4. We could not assess further because the pain was so severe that she could not lift the leg or find whether it's grade 5 power or not. The reflexes were well present. The upper limbs are perfectly normal. The systemic examination was normal. The general examination, she had no pallor. The pulse BP was perfect. Now comes what was my provisional diagnosis, our provisional diagnosis when we are seeing her. We thought of one was Chikungunya, because that is now present after post-COVID. We have started seeing cases of Chikungunya with severe pain in the lower limbs. 2 was Guillain-Barré syndrome, because we started after the fever, and 3rd was acute polymyositis or acute myositis. Now we started investigations on those lines. So what were the investigations? We went through the basic hemogram was normal, the biochemistry like LFTs, RFTs was normal. ESR was around 22 millimeters. The X-ray chest was normal, USG abdomen normal. Chikungunya antibodies and Chikungunya tests were negative, dengue was negative, RA factor normal, negative. Comes to what we did for evaluating of Guillain-Barré. We did a nerve conduction study which was plumb normal, so that ruled out the Guillain-Barré syndrome. We went, the EMG, the electromyography also picked up that there was no evidence of polymyositis or myositis. We even scanned we did an MRI brain, we scanned the spine, we did an MRI of the lumbar spine, the full spine, there was no evidence of myelitis. So these were the investigations which all were normal. What happened then in the hospital, the further course in the hospital, was that we had no clue to the diagnosis. By now the relatives were apprehensive, the pain was very severe. The pain was so severe that at times when I went to the lower limbs, when I used to just put my hand near the thigh, and she used to shout with pain, even before even touching her. We thought that was odd. I am not even touching her. Why is she shouting with pain? And any part of the body, the lower limbs was painful, whether it's the calf or whether it's thigh, just press the thigh and she used to yell with pain. Now, we really don't know the diagnosis. This went on for 1 or 2 days more, and we had put her by now on treatment of paracetamol. She was on multivitamins, but she was getting no relief with this treatment. It was, how did we get the clue to the diagnosis was, one day on the rounds, she said I was 50% better. As we were very happy, we told her the next day we will discharge you. And the next day, she gets, when we went to see her, she is now shouting with pain, and the pain was 10 times more than it was earlier. That's what put us to the clue that whether this is functional, whether this is psychological, whether she's malingering pain to some extent where she really had nothing. So we then did thinking of a psychological, we evaluated the history again. She told me that she was in the 9th standard. Then I asked her, when are your exams? Because this is a lockdown period, so the exams are supposed to be online. So we asked her, when are your exams? She told me the exams are ongoing. The second paper is on today, and it will be on for another 4 or 5 days. That's the time we realized probably she does not want to give the exams, and she's malingering pain, and she's trying to show that she's very sick. So we had to do something to help her. Now she asked me a question, that girl. She told me, doctor, what are you doing for my pain now? I'm not getting any relief, and are you doing something about it? So we had a brilliant, unique idea. So what we did was, we took the the crepe bandage or sticking plasters, which we put to patients. and we cut them into small pieces and we put one behind both the thighs and one behind both the legs, which you can see in the photo. So with that, the next day she's saying, I'm feeling 50% better. Now imagine I just put a sticking plaster to her leg. I have not given her any different medicine and she's already 50% better. That's the time we were confirmed that this is psychological. 2 days later, the exam got over. And the next morning when we went in, how you feeling? She was walking in the wards all over without any pain. Now before this, she used to undergo physiotherapy. She was not able to even walk with the pain. But now she's walking all over the wards. She's saying, I'm feeling absolutely fine. So we realized this was all the while it was a psychological pain which she had and she had nothing serious. So my final diagnosis in this case was a psychological acute myositis like picture. Maybe a post-viral picture, but it was a post-viral was the problem, but it's acute myositis, which is a psychological in origin. What is the take-home lesson in this? What did we learn in this case? We learned that all the cases have to be taken. First, you have to think that there's some organic problem. You have to evaluate all the tests, do all the tests which are required for the patient. That is for evaluating organic cause of our complaints. If you find that there is no, you are finding all the tests are negative and the clinical symptoms of the disease are not fitting into any clinical picture or a diagnosis, like it's not fitting into hypertension or diabetes or chikungunya or dengue, then is there psychological, such patients? But to know that psychological, you have to go back to the history. You have to find out there always is a precipitating cause for the psychological illness. So you have to go back into the history, find out that precipitating cause and then treat that precipitating cause. And then you have to get some unique ideas of treatment like we did putting a plaster to the patient and feel that you're doing some treatment to the patient. So you should also come up with some unique ideas, for that. So that's the time the patient improves with your treatment, which is psychological. That means this was a psychological fever or a psychological, patients come with fever, patient come with joint pains, patient can come with abdominal pain, just anything. So that's how you label this as a psychological case. Before that, don't do it before you evaluate for organic causes. I hope you like this video. We'll be sharing many such videos for you in the future with cases, with interesting cases.